Hey everyone, just want to share a quick tip with you on the, this is the Mindray A4 unit. Just some quick tips on cleaning and also when you're troubleshooting for this unit. Like most anesthesia machine, I would encourage you follow the service manual procedures, but this is just a quick look at some of the areas that I find that sometimes are troublesome with anesthesia machines due to just basic maintenance. On this one in particular, the A5, this is one of the areas here. This is the breathing system, and I have this one taken apart, and basically we have our solder line here, and these are areas where we need to inspect, especially in here. I cleaned this one out pretty good, and there's a tendency for these particles to fall in here, and they can actually create a leak in this area, and this is an area that we want to clean often, and I want to encourage you to take some time to do that. Those of you that are maybe new to cleaning the units, follow the service procedure. And another area here that I want to show you is the flow transducers. These are also prone to sometimes cause problems, and you can tell if you're having problems when you look at your display, and if you see that your volumes are off. These might be a good area to start looking and cleaning these out or calibrating that part of the procedure for the calibration of the flow sensors. And there's two of them on each side. Basically just unscrew this, you put them back in place like I did, and basically after you do that, you just want to start to put everything back in place, so this way that snaps back in place there. Some of these are pretty straightforward, but maybe you're new to this and you're not too familiar with how this is put back together. These are just quick little tips. You have your handle over here, press up, locks this into place there on the anesthesia machine. And then you have your breathing circuit. Right, you have our breathing circuit. Machine is set up. Once we have all this back in place, another area I want to encourage you to check your little valves over here. Sometimes these get dirty. These just basically unscrew, check them out. Make sure these, I call them the little spider valves in here, that these are not dirty. These lift right up. But these are just little tips that I think will really help individuals to be able to better troubleshoot and maintain the machine. So we're going to go ahead and just power it on over here. And once we get the unit powered on, we're going to just, again, look at the display, make sure that our volumes, everything is accurate. We have our O-rings that we have here for the vaporizers. Check to show the cap on the vaporizer locks into place. Everything is nice and tight. We don't want any leaks anywhere. Then of course we want to make sure that our gases are connected, right? All our gases are connected. Some units use portable tanks. Make sure that the tanks are all full if you have tanks. So that's pretty much giving you like a quick little run around of the unit. So we're going to go ahead and just press this little button here as we're going to just try to run the unit. Make sure that we have our lung. We're going to move this lung from here, and I'm going to put it on this side of the unit. So I'm going to put this down here just for a minute so that you can see. Then when we press the, I call it the green oxygen button on the front of the machine. It says O2 for those of you that are new. We want to fill up our lung, such as this, after we press this button in here. So now we have our lung. The machine is cycling, as we see here. And again, it's just a quick video, basically just running, operating the machine. We see our bellows filling. We see the machine is cycling over here. And that's what we want to make sure that there's no leaks, that everything is running as it should. We have our volumes around 500 VT. We have expire volume right now, 478, which is good and is climbing, which is fantastic. And that's the area. Our tidal volume is 594, dialed in 500. That shows me our flow sensors are operating. If we're having a problem with that, we want to go ahead and check, again, our flow sensor, either calibrate them or we might have to replace them. So again, these are just quick tips. Encourage you to follow the procedure manual for the Mindray units, but if you're not too familiar with them, wonderful machine, and I would encourage you to spend more time learning it. What I'm going to do now is I'm going to put back my oxygen sensor, and this connects right back in here. That's for your oxygen percent. Put that back in there, and that's going to then start to increase my FiO2 that I have set, which is our oxygen, and of course our green line, which is our oxygen on the wall. So we see that climbing, we see our oxygen sensors working, and if you have, again, a problem, you will replace your oxygen sensor over here, or try to calibrate it first. I always try to follow the calibration procedure because I think it's just a lot better. But anyway, I hope these quick tips have helped you a little bit and just familiarizing yourself more with the Mindray units.